Earaches originate from a number of different causes. Although potentially painful and frustrating, most are not dangerous. As with most symptoms you experience, it is an indication of something wrong. It's important to also pinpoint the origin of the pain and not just treat the symptom. There are several reasons you may experience an earache, including earwax buildup against the eardrum. Other causes for ear pain include middle ear infection, outer ear infection, injury to the ear canal after inserting something, pimple, infected hair follicle or boil, throat infection or cold, temporomandibular joint pain, bruxism or teeth grinding, trigeminal neuralgia or fascial nerve problem, sinus infection, barotrauma after pressure or altitude changes, also called airplane ear, dental abscess, tooth pain or wisdom teeth problem, foreign body stuck in the ear canal, more frequently in children. Although there are several remedies you may use or start at home to ease the discomfort of an earache, it's important to understand why your ear hurts, so you may seek medical attention for the underlying cause if necessary. Start by asking yourself some of the following questions about your symptoms to help assess whether medical attention is necessary. Is the pain associated with a cold or the flu? This pain is more likely to come on slowly, as congestion with a cold builds. It usually goes away as the cold resolves. Is there pus around the outside of the ear? May be the result of an eardrum rupture from fluid buildup in the middle ear. When the eardrum ruptures, the pain almost disappears. Have you been flying in an airplane or scuba diving? You may be suffering from barotrauma from altitude change. If you have other body symptoms after scuba diving, seek medical care immediately. When localized to the ear, most cases resolve with chewing gum, sucking on hard candy or yawning frequently to equalize pressure. Do you grind your teeth at night? This increases muscle tension at the jaw and may be interpreted as an earache. Seek attention from your dentist or orthodontist for a night brace to stop the grinding and prevent permanent damage to your teeth. Is the earache associated with tooth pain or discomfort near the back of your mouth? This may be the result of impacted wisdom teeth or a cavity. Your pain will not resolve without attention to your cavity or wisdom teeth by a dentist. Does the pain in the ear get worse when you tug on the outer ear? This may indicate swimmer's ear. You may also experience fever, drainage and pain that spreads to your face and neck. A massage technique is demonstrated to help the eustachian tubes drain and reduce pressure on the middle ear from fluid buildup. Although infections may occur in any of the three parts of your ear, an infection in the inner is the most dangerous to your hearing. Common middle ear infections rarely require medication except when they are severe in young infants. Several of the options available at home may help to reduce your pain and discomfort without the added risk of pain medications. As you consider these options for treatment at home, remember to never put anything into the ear canal. If you think the eardrum may be ruptured, or if you know there is a small hole in your eardrum, fluid or oils will drain through the hole and potentially damage the delicate bones behind the eardrum, leaving you with permanent hearing loss. If you experience a buildup of wax near your eardrum, it can cause pain and a feeling of fullness in the ear. You may easily remedy the situation at home by using a liquid to soften the wax, so it can migrate out, or use an ear irrigation tool to flush out the wax. Acceptable fluids are saline solution, coconut oil, hydrogen peroxide, carbamide peroxide or olive oil. It may require irrigation of the ear canal with a syringe to remove. However, if done improperly, it can damage your eardrum. You should not irrigate your ears if you have diabetes, a tube in the eardrum, if your eardrum is perforated, or your immune system is weakened. Removal in these circumstances require the care of an ear, nose and throat doctor. When ear pain is associated with a middle ear infection, there may be an increase in fluid behind the eardrum that triggers the pain. There are several ways to reduce the pressure, and thus reduce the pain. Massage techniques can help open the eustachian tubes and increase the flow of fluid out of the middle ear. In the same manner, yawning or sucking on hard candy encourages thick fluid to flow down the eustachian tubes. Sleeping sitting up will also help reduce the pressure on the eardrum, the cause of the pain, for an increase in fluid. Gargling with salt water may help to loosen thick fluid in the eustachian tube, and may help to kill viruses in the back of your throat, reducing the length of a viral infection. Gargling with apple cider vinegar will also help if you have an infection from a fungus. If you are bottle feeding your baby, it is important they eat in a more upright position, to reduce the amount of formula that enters the eustachian tube. Hot and cold packs can be used to help reduce pain. Cold damp washcloth held on the area for 20 minutes may help to numb it and reduce the pain, while a warm, wet cloth for 20 minutes may help relax the muscle tension around the ear and improve blood flow. You can also make a hot pack with a cup of salt or rice, warmed in the microwave or stove and placed in a sock. When bearable on the skin, place it over the ear for 5 to 10 minutes. Garlic has natural antimicrobial and pain-relieving properties. You can eat 2 to 3 raw cloves of garlic daily, and make ear drops by cooking 2 cloves in 2 tablespoons of sesame or mustard oil until it darkens, then strain. When the oil has cooled to the point it isn't too hot on the inside of your wrist, apply 1 to 2 drops in the affected ear. The same can be done with onion juice. Chop a small onion, and heat it in the microwave for 1 to 2 minutes. Once it has cooled, strain the liquid off and place several drops in one ear. Leave it in for approximately 10 minutes, and then turn your head to drain it out. Repeat with the other ear. Breast milk has natural antibodies that speed healing and reduce swelling, working in both adults and children. Use 2 to 3 drops in the affected ear every 3 to 4 hours as needed. A few drops of 3% hydrogen peroxide into each ear at the start of symptoms of a cold or an earache may also improve symptoms within 24 hours. Chiropractic adjustments are effective when your ear pain originates from neck and shoulder muscle tension, or if you have middle ear fluid. In the first case, a chiropractor may evaluate your posture and give you exercises to reduce a potential problem with imbalanced muscle development in your shoulders and back that trigger the tension. An adjustment may also help open your eustachian tube, so fluid flows more freely out of the middle ear and reduces your pain.